One afternoon I was interviewing a new patient, and she was telling me about her foot problem, and at the end I said, I think it might be coming from your sciatic nerve. You got any low back problems? And she said, oh no, I had that fixed 2 years ago. She says, this is different. I know what sciatica is like, and this is not like what I had before. I said, how'd you get it fixed? And she said, I had Bowen treatments. And I said, what's that? And she told me a little bit about it, and I'd had back pain, sciatic nerve problems for about 12 years, and I'd been to chiropractors and acupuncturists and physical therapy, and the pain was getting worse, and I was afraid I was going to have to see the neurosurgeon. So I probed her a little bit about it, and she told me about the gentleman who did the therapy, who's about 10 miles up the hill from me in Sacramento, California. So I made an appointment, and when I get to his house, there's an old lady sitting on the front step smoking a cigarette, missing a couple front teeth, looked like a bag lady. She said, if you're here to see Milton, you ring the bell. He answers it himself. Well, as it turns out, this guy has an unlisted phone number. He only answers his phone an hour a day between 8 and 9 in the morning. And when I called for an appointment, he was booked up 3 weeks in advance, excepting he had a cancellation that afternoon at 5 o'clock, which I took. So he greets me at the door and takes me back into a bedroom, lays me on a massage table and starts rolling and poking my muscles. And I'm thinking, this is a joke. What's this guy doing? And then after he rolls and pokes a few muscles, he leaves the room. And then he comes back 2 or 3 minutes later and rolls and pokes a couple more muscles, then leaves the room. He didn't explain anything to me. But after about 5 minutes, I started to get very mellow and almost went to sleep. And he turned me over on my back, and he did some stuff down in my lower legs and my neck, and then he gets down inside my groin, inside the thigh, and he rolled that muscle. And oh man, I thought I was going to hit the ceiling. And he left the room for one of those little timeouts, and my hands started to sweat. And it was not really perspiration sweat. It was kind of a sticky, carob syrupy kind of substance coming out the palms of my hands. And I could also feel some of it was coming out the soles of my feet, although I still have my socks on. And he came back in the room and he saw me touching my palm of my hand, and he said, he touched my hand and he said, ha, toxins coming out. I said, oh yeah, what kind of toxins? And he smelled his fingertips and he said, it doesn't smell, so it must be lactic acid. So I said, whatever. And so he gets me up off the table, and my pain was gone for the first time in 12 years. My whole right side had tightened up during the course of time, and my back ached, and my groin ached, and my foot was stiff, and my jaw was out, and all that was gone. It was totally loosened. And so over the course of the next week or so, 4 different foot and leg problems cleared up, including hammer toes on my left foot straightened out somewhere between my morning of discovery and the afternoon of the treatment. And when that surfaced, I said, I've got to learn how to do this. So I went up and he taught classes, and I took a 4-day workshop and started learning how to do the process of Bowen therapy. Went back to my practice and started integrating it in to see where it would fit. And almost every podiatry patient needs Bowen therapy. A lot of people have been favoring their foot pain for months and months and months, and now their hip is painful, their back is painful because of favoring their foot. And I noticed that I didn't have to inject as much cortisone, didn't have to prescribe as many drugs, didn't have to do as many surgeries on my podiatry patients as I did in the years past, because this therapy just absolutely fixed many of their foot problems. Also, in the years past, when I was practicing conventional podiatric medicine and foot surgery, my overall results were about 80% favorable. And when I started incorporating the Bowen technique into my practice, my results went up to about 95%. My patients loved it, and hardly a day went by that a patient wouldn't say something like, oh, Dr. Mosher, I don't know what you did last week, but you changed my life. And another one might say, you wouldn't believe what happened after that treatment last week. Oh my gosh. And then they tell me what happened. And another one would say, gee, I had a runner's high all day after that treatment you gave me last week, and now I feel a sense of peace and balance and well-being. And another one would say, if only the medical doctors would take this holistic, naturopathic approach to our healthcare issues. And last but not least, often people would say, you know, I've been through 5 years of hell. I only wish that I'd met you 5 years ago. My life would have been different. So check it out. Try to find a Bowen therapist in your area. There's a bowendirectory.com, and there's of a number of practitioners geographically located. And check it out, try it out, and see if it doesn't change your life. Have a great day. Thanks. This is an example of the world's renowned Bowen therapy technique, which I used along with my foot taping, strapping for bunions and plantar fasciitis and all kinds of foot and leg and hip and back problems. And the moves, as they're called, are made on the muscles. And it's just a gentle rolling of the muscle with my thumbs and my fingers. And what this does is it sets up reflex arcs. When your doctor hits your kneecap, below your kneecap with the rubber hammer, and the knee jerks, that's called a reflex arc. It's a signal to the nervous system. It makes a message go back to the muscle to contract. In Bowen therapy, the reflex arcs cause the muscles to release and elongate. Many of these moves are made over meridian points, and the meridian pathways, meridian channels, or ductules as they're called. So it releases energy called chi, and it opens up the ductal pathways so that the chi can flow more freely along with the lymph and the blood and the water and all the other that has to get through the tissue spaces. After doing a few moves, there's a rest period for that to process, because the body is like a computer, takes in data, processes data, stores information, and puts out information at the cellular level. So that's what the rest period is, to allow the body to process the data and to allow that energy to flow and allow those muscles to relax and elongate. The rhomboid muscles, which are around the shoulder blades, when I go through and do those moves many times, first time through I'll feel these lumpity lumps, and then I come back 5-10 minutes later and the lumpity lumps are gone. So that's how I know that this causes them to elongate. So after 2-minute rest to 3-minute rest, we do the second part of the procedure, which again is just a little gentle movement to the muscles. And you always do both sides to keep the body in balance. And I'm doing the moves a little firmer than I usually do, just for demonstration purposes on the video. And there's no lumpity lumps. These are called boomerang moves. This originated in Australia from Tom Bowen, an Australian in the 1950s, figured out the system. And after doing the first 2 relaxation moves on the back, we turn the client over, and you can turn on over, and we do the third relaxation procedure, which is the neck. And you can slide down toward the table, just foot of the table, just a little bit, sir. Head's out of the hole, your knees behind the pillow. Pillows behind your knees. And these little movements are made on the front of the neck, on the scalene muscles, it's called. And I'll take my thumb and I'm going to move the muscle toward the middle. Move the muscle to the middle. And I'm taking my middle fingers and I'm putting behind the skull, behind the neck, just below the base of the skull. And I'm making a little move toward the spine with my left hand, a little move to the spine with my right hand. And then there's a 2 to 5 minute rest. And after the 2 to 5 minute rest, we come back and do the main muscles in the middle of the neck. These are called the trapezius. And I'm going to move the muscle to the spine with my left hand. And with my right hand, I'm going to move the muscle to the spine. And I do that in about 3 different places. In the middle, slightly up above, and slightly down below. Lots of times when I do those, people can feel like goosebumps going out of their toes. The sinuses will clear, headaches will go away, all kinds of things happen. And it's a marvelous technique for all kinds of conditions, especially neuromuscular pains, the back, the neck, the shoulders. It's good for the TMJ, helps knee pain, helps foot pain, as I said, bunions, hammer toes, plantar fasciitis, balances the pelvis, balances the upper body, and gets everything flowing and communicating better. And so that's the basic relaxation procedures of the Bowen. Thank you for watching my video and have a great day. Oh, it's another beautiful, wonderful morning at the always beautiful Daniel Stowe Botanical Garden, just outside of Charlotte, North Carolina. And the Orchid Conservatory and the pavilion is over here, and it's a wonderful place to go for a morning walk. Today I'm going to tell you a story about fibromyalgia. Once upon a time I went to a fibromyalgia support group meeting to give a show and tell on the Bowen technique, and I gave the tell part. When it came time to do the show, I had a victim come up and sit in the chair facing the back of the chair with his back exposed to the group, and he sat there and I did the lower back, upper back, neck basic relaxation procedures. And after a few of the moves, he said, "Gee, I can feel heat coming out of my back, and I feel tingling down in my legs." And I said, "That's not too unusual. That's the energy releasing, and changes taking place." And I did some more moves, and he said, "Boy, I can feel more tingling down into my feet." And I said, "That's not too unusual." And altogether, I spent about 5 minutes doing those 3 procedures for him. And he got up and stood and said, "Wow," he says, "I can feel my socks with my toes, and my back pain's gone, and my neck doesn't hurt." He twisted his neck back and forth. He said, "Wow, this is great. I want to do a full, real session," because a full session was done on a massage table. And so he booked an appointment at my office the following week. And when he came, he really didn't need the session. He was pretty well pain-free, but he had one anyway. And when he got on the table and I started working on him, he told me his story, which started about 5 years before. He developed back pain, went to his family doctor. Family doctor checked him over and said, "Well, since you got the neuropathy in your feet," he said, "I'm going to send you to a neurologist." So we went to the neurologist and had some tests done. The neurologist put him on pain medication and muscle relaxers. And he developed then, a few months later, pain in his neck. So we went back to the neurologist. The neurologist threw up his hands and said, "I don't know. I'm going to send you up to Wake Forest University to the head neurologist, head of the department." And so he did. Head neurologist did some more tests and put him on stronger pain medication. And the patient found that if he mixed the pain medication with alcohol, he got a better high. And so he, over about a year and a half's time, became dysfunctional enough that he lost his job, almost lost his family. He, a year later, went to rehab and got off the drugs and alcohol. And he was just living with the pain and taking anti-inflammatory medications by the truckload. And he was amazed at how pain-free he was with just that one session for 5 minutes sitting in a chair backwards. So that's my story on fibromyalgia. I don't think he really had fibromyalgia. I think he just believed that he did because the doctor told him he did. And so anyway, he's getting back on his feet and starting to work again part-time. And hopefully his life will be better. And I want to thank you for watching my video. I'll see you next time. Have a great day.